first started to get a little sore. I was out hunting with my dad and some of his buddies with my dog. So I was running around a little bit, and I started a new hobby of carving ducks out of wood. And my body just started to feel a little sore. Within the next 2 or 3 days, I started to develop a rash and a sore throat. So my wife made me go to the doctor. They did a strep throat test. That came up positive, which I didn't end up having, but I had something they call scarlet fever, which is a bad rash you get on your skin. So I took some medications, went home, ignored it. I was in so much pain, I had to sleep on one of those gravity lounger chairs because my neck, couldn't lift my neck up, could barely stand up. She would have to help me get up to do everything. And I was trying to ignore it, trying to avoid going to the doctor again. But she made me go to the hospital. They rushed me in thinking I had meningitis, so I didn't have to wait long. It was like a 10-minute wait. So I get in there. I was at Kennedy, and they wanted to do like a spinal tap. It sort of freaked me out a little bit because I don't do doctors much. So I'm laying there. I don't really remember much. I deteriorated very quickly within about a week or two. Every organ in my body was about failing. But I remember it like one night. They did a spinal tap. They did some lung biopsies. They had me upstairs, downstairs, back up in the ICU. And one of the doctors there mentioned a machine called ECMO. And they said I probably need it for my lungs, which were failing quickly. So that's at Kennedy. And then I was helicoptered over to Temple February 11th, which was about 10 days later. And I was put on a machine called ECMO, which is a pretty cool machine. Your lungs don't work anymore, so they're just kind of sitting there. And they take all the blood out of your body and put it through a machine that's a pretty cool looking box, like futuristic. But it's little. I thought it was bigger when I woke up and started remembering a little bit of things. But I mean, it's only the size of like this computer screen. And it filters your blood. It puts in oxygen, takes out carbon dioxide, and whatever your lungs are supposed to do. And you're on a lot of heparin then, so you bleed. Everything you do, you bleed. So they had to like tie me down, and I kept playing with stuff. I was unconscious then. Some dreams, aliens were working on me. That was one thing. Which the arms of the bed are kind of like alien arms, but it was aliens working on me. When I woke up, finally, I was sort of still on the ECMO machine. I was coming off of certain things. I was coming off of the tube in my mouth to make me breathe. And if you ever seen the movie Saw, I couldn't talk. I couldn't move. My body lost about a month and a half now of deterioration on all your muscles. I mean, I used to be able to lift a lot of stuff. I was very active. So I wake up, I can't talk because they got the thing in my throat. I mean, it was just like the movie Saw. You're laying there, you don't know what's happening. It's like I fell asleep at Kennedy, just hoping to go home a week later or a day later with an IV of fluids and be back to normal. Everybody had to tell me over and over again what was happening. So after a while, they took all the machines off, or before that, they had to reteach you how to breathe. So they take a tube in your throat, take it out, you breathe room air, put it back on. So you don't realize with your throat muscles, you can't swallow because your muscles aren't strong enough. You can't talk because your muscles aren't strong enough. You can't breathe because your muscles aren't strong enough. So for about a few weeks, they take it off for 5 minutes, put it back on. Take it off for an hour, put it back on. And we've done a lot of talking to lung doctors and pulmonary specialists, or whatever they're called. People that help you with that. When people are going through this, it's pretty scary because when you breathe, you don't really feel your lungs that well. Like, you feel it in your throat, not in your lungs. So when they hook this machine back up to you, you're suffocating, but it doesn't hurt like it does when you hold your breath, but you feel like you're suffocating. You have no idea what's going on. So that was a kind of weird experience for a few weeks. Then finally, you're off it for 24 hours. They move you to a ventilator recovery floor where they start physical therapy a little bit. I had to relearn how to stand, relearn I couldn't sit up in bed, my arms would barely work. So that picture there, I couldn't do that. We tried day after day after day, and we just kept failing, but we kept trying. That guy there actually used to drag me around. I got still scars under my armpits because I wanted to walk so bad, so he would hold on to me and just drag me around, and I kind of dragged my legs. And I had really fair skin from the drugs, and everything cut me. So yeah, they had some cool little bikes there, but the PT stuff, they're trying to, a lot of the guys there fight for more money and help. They're trying to do pet therapy there eventually, which will be helpful. After a while, they take the trach out, and kind of freaks you out, but it's all okay. I mean, the people keep explaining to you that you're going to be fine, and they keep messing with it. It kind of scares you because they're messing with your throat, messing with your breathing. But finally get that out, and they move you up to a rehab floor where they intently teach you how to walk, teach you how to do everything again. By now, I was on the chemo once a week, and steroids every day, and all crazy, cool name stuff, like cyclosporin, pretty cool name, Histiocytosis, cytoxin. So that stuff, as that was coming to an end, I started to get stronger, finally able to let me go home. The PT people there were great. I still talk to them once in a while. Or I had foot drop, which is you get that a lot in car accidents or something, nerve damage. Being critically ill, my left side of my leg is still pretty numb, getting movement back and feeling back. And then today, I'm dealing with something called Still's disease, which is what triggered me to get HLH. Still's disease is an arthritis. Arthritis, I guess, is, I mean, I'm learning stuff when everybody's talking too. It's like brand new. But Still's disease is where your white blood cells attack your joints, like arthritis is. And I guess my white blood cells just went crazy. So with Still's disease, there's a lot of different treatments. So I try to pass the time with carving the ducks. I won second place in a contest down in Tuckerton last weekend. On the first one, I was able to finish with severe arthritis, which is finally under control with some new drugs they switched me to a few weeks ago. And hopefully it stays that way. But the one thing I did wrong was not go to the doctor and ignore everything. And with awareness, I got diagnosed, in March? I went into hospital in February 2nd. So I went all of the month of February with this disease just killing my body, killing my organs. And if I was diagnosed in February, I could have started the chemo treatments and not have to deal with a lot of the walking stuff that some other people don't have to deal with. I got lucky with the treatments worked well for me. So today I look normal. I look and feel like I used to almost, just a little sore a lot, and not quite what I used to be, but with the proper awareness, if all my doctors were aware, and it's hard to be because it's so rare, if they could have caught it earlier, I could have been running around 3 months ago and not have to go through the ECMO, not have to go through the breathing tubes, not have to relearn to walk, relearn to talk, relearn everything. They had to start me out on food that's horrible. They use a blender. And then try drinking water that's like, it's cream of wheat tasting water. And it's so thick, you gotta drink it with a spoon, and they tell you to drink it with a spoon. So hopefully, I met a few doctors one was from Brazil. She was doing a rotation, so she went back down to Brazil and will be, I guess, whatever the next level in being a doctor is. I'm still learning that too. So now, HLH is known about, and histio stuff is known about in Brazil. So we're trying to get it all over the world and do what we can to make people aware. And you really do need good advocates if you're in the hospital sick, because your family treats you the best. They're there. They know what medications you're supposed to be on. I still can't keep track. I don't know what medications I take. My wife gets them ready for me every week. I won't ever be able to keep track of them. She needs to remind me. So you do need good advocates. They're there with you. Try to get them there with you as much as you can. And that's about it. They were great. My whole family was there every day. It's a pretty scary experience back then. Freaked me out a lot. So you don't really, you know, if you're ever in trouble, just don't be too scared. I think you'll be all right. And any questions, you're more than welcome to ask anything. You know, you won't offend me with anything or whatever you want. I think that's it. Oh, the dog. Pets help a lot. And I thought that was a cool picture. That was one of my last outpatient